Should the autism spectrum be split into two? This is a very tough and controversial question. Parents of those who have quote unquote profound autism feel that they're being ignored or their experiences are being made light of. So, what do we mean by profound autism? This is typically a child who has limited verbal communication, intellectual functioning that would fall in the significantly underdeveloped range, someone who might have trouble with feeding themselves, toileting themselves, being safe, often have extensive self-injurious behaviors, sometimes even needing round-the-clock care. Parents of these children sometimes feel invalidated when it's said that autism is not a big deal, nothing to fix, it's nothing to cure. However, many of these parents are unable to work. They have to find ways to support their children requiring extra services, extra medical care, extra money for somebody who then is not able to work. Not to mention hours of time filling out forms, applying for Medicaid, disability, all sorts of things. The amount of time that is required and making sure this child is safe and that you're safe and that your other children are safe is exorbitant. And this is for the rest of the child's life. And then on top of that, they have to worry about who will take care of this child, where this child will live as an adult, or when the parents are no longer alive. That is an incredible burden for anyone to take. So the big thing that the article showed was a graph showing how the rates have changed since the 90s in terms of the profound autism group, which only rose a tiny bit, whereas the higher functioning, less support need group rose much more exponentially and significantly. The controversy stems from the fact that people feel that certain groups are being neglected or would be neglected if there were changes to how we label or divide up the spectrum. So parents of kids who are profoundly autistic are frustrated because the research now has gone toward less support needs, whereas the profound autistic children have been unable to participate in many studies and have not gotten nearly enough grants or support. Questions like, why is my child having seizures? Why can't he stop banging his head? How do I get him to sleep at night? And so these are the people who are saying, call it a cure, call it fixing it, whatever you want. I want to understand why my child has to suffer, and I wouldn't wish this upon anyone else. So for some people, they may feel like it's nothing to be fixed, but for others, they may feel like it is something that we would want to be fixed because it's causing pain and suffering. Many have referred to autism as having superpowers and being quirky, whereas, again, this feels invalidating for the parents of those with profoundly autistic children. Of course, they have strengths, but they also have these very significant challenges, and it's concerning, and it changes the parents' entire lives. It changes the child's entire life. They take offense to the word superpower because that's not their experience. Also, those in the lower support needs community sometimes feel like if they lose their autism diagnosis or the focus is shifted to the profound autism group, that they will be seen as having invisible disabilities because they're smart, they get by in school academically, and they require a lot of service to get from the point where they can just do well in school to the point where they can function independently and attend college and hold a job and have accommodations that they need. So it's very complex. My professional opinion is I don't know the entire answer, but I do think there needs to be some differentiation between the groups. What works for one child or adult may not work for another. The medication regimens can be really different kinds of therapy. Someone who's low support needs might benefit from cognitive behavioral therapy, while a child with profound autism might need intensive one-to-one discrete trial ABA. Some might need their parents to gain a guardianship, have a special needs trust, while many people who are lower support needs can support themselves, can live independently. So it can be a very, very different picture, and it's important for us as clinicians to understand how to support these different profiles and for them to be eligible for the right services. Funding is an issue overall, we know that, but I think that's what it comes down to. Everyone's concern is the fear that they're going to lose their supports, their validation, their services, and not be understood by others.